Welcome, ladies and gentlemen, and our distinguished audience, and most importantly, my fellow young people, to this webinar, what we like to call How Can Young People Drive Accountability in this era of the development? You're here with me to color Itai, and I am representing the Adolescent and Youth Constituency under PMNCH, which is the Partnership on Maternal, Newborn, and Child Health. And most importantly, how can young people play a very strong role in driving accountability nationally, regionally, and internationally? The constituent launching their very own accountability brief. It's coming out soon. Look out for it, and we'll be sending out. But it basically gives an overview as young people how we can take charge and drive issues accountability, holding leaders accountable, civil society organizations. So it's got tools and ways that we can just get involved as young people. So I hope you're looking forward to that. But let's talk about the webinar. We have amazing panelists, dynamic panelists with us today who are going to be sharing about the different tools that they're using, as well as their inputs as well, to ensure that young people are agents of change. As you can see here, we have our agendas and our speakers, the ones that will be sharing in our webinar today. You can briefly have a look at that. Start off this afternoon. We would like to ask who's representing Every Woman, Every Child. She is the senior manager there, a very dynamic woman, I must say, who's really has been pushing issues of adolescent health, and that's what we're going to be talking about. So she's going to give an overview of just setting the scene when we talk about accountability. What does this look like? So over to you, Nana, to give us just an overview on set the scene right for us.
Hi, good afternoon, good morning, everyone, and thanks so much to Carla. I'm really looking forward to this webinar today. I hope everyone can hear me clearly. It's a real pleasure, and I thank the PMNCH for organizing this, and particularly the AY constituency, to Carla and Gigi and others, and Patrick, who are all online today. So I've been asked to give a quick overview on Every Woman, Every Child and the global strategy for women, children, adolescent health, and the role of youth-led accountability within that. I hope you can see my slides. I just got a couple today. So Every Woman, Every Child is a SG UN Secretary General-led initiative that started back in 2010 to really look at how to advance the health-related MDGs, so reducing maternal and child mortality. But now we're in a new era, and we're in the era of the Sustainable Development Goals, the 17 Sustainable Development Goals. And as part of our transition to that new era, there was very strong recognition that we need to include adolescents and youth into the focus for reasons why. First of all, the new SDGs really take more of a life course approach, and SDG 3, which is the health focus goal, really looks at health and well-being for all. So in terms of the right to health, that is applicable for everybody, including youth and adolescents. Also recognizing that to be able to end preventable deaths for maternal, newborn, child, adolescent health, we need to include the focus on adolescents and youth. Not only because we've seen not a few improvements in health among adolescents, which is 10 to 19, but also young people 10 to 24 years old over the last decade or so. And today we have 1.3 million adolescents die each year from preventable causes, and that's a significant number, which many are preventable. But also recognizing that good health in young people and adolescents actually helps improve adult health as well, and that 70% of premature deaths among adults are actually linked to unhealthy behaviors that start during adolescence. So it's such a critical piece to health and well-being across the life course for all. But also, every woman, every child has really recognized that to be able to achieve the Sustainable Development Goals by 2030, we need to ensure that women, children, adolescents are actually the drivers of that transformation and change. Without better health and well-being for women, children, and adolescents, we won't be able to achieve those goals. And to be able to ensure that adolescents are fully empowered and fulfill their full potential, we need to ensure that there are stronger investments in their health and well-being. But that also includes more engagement and participation by adolescents in policies and programs. And this is again where we've seen a major gap in the past, particularly in regards to the health and development sectors. We have not really seen a strong focus and investments in adolescent and health programs overall. And traditionally, has been more included either as children or as adults, and not really had a dedicated focused programs. So that's again something that Every Woman, Every Child and the Updated Global Strategy tries to address. But bringing us back to the conversation around accountability for today, Every Woman, Every Child has really had a strong focus on the importance of accountability from the beginning. And it's been a really critical cornerstone of Every Woman, Every Child's work. Not only recognizing that accountability starts at the community level by individuals, but also taking that to the subnational levels, regionally, and also at the global level. And the updated global strategy has, again, a strong focus on accountability through the Unified Accountability Framework. And I think the reason why accountability has really been highlighted is because without accountability in terms of being able to monitor, review, and act on progress, then we often see that promises pledged, commitments made, particularly by decision makers, are sometimes not delivered upon in a timely manner. So how can we also ensure that there is strong youth-led accountability within the Every Woman, Every Child Unified Accountability Framework? And we see some important critical opportunities for that. First of all, understanding that there are many different platforms and tools, which many of our presenters later today will talk about. But I will just give a very quick overview in terms of some of the opportunities that we see. So youth and adolescents should be involved in more of the formal processes that have been now established in terms of the Sustainable Development Goals follow-up and review. So those really start at national level, and many of you know those are voluntary national reviews. So every year, a number of countries volunteer to review their own progress in terms of against SDG goals and targets. This year, we have over 40 countries that will be reporting on their national progress in July at the high-level political forum. And next year, we've seen the number of countries very much grow. But these are voluntary, and overall, I think countries are encouraged to report back twice over the 15-year period of the SDGs. But actually, we've actually seen some countries wanting to report every year, and I think that should be very much encouraged. So one of the critical questions is how can adolescents and youth be engaged in these national voluntary reviews? Please look at your countries and whether your countries have volunteered, and very much we would encourage being engaged both at the subnational level through, say, some of the efforts by the Every Woman, Every Child partners, such as through the citizen hearings and the work of PMNCH, in ensuring that there is strong dialogue at the community level and at the subnational level with decision makers in terms of where we see bottlenecks in programs, in delivery of services, but also ensuring that you have a say in terms of how programs are decided upon. Where should, say, health facilities or adolescent-friendly services be situated? Where would they make more sense and be more accessible to young people? But also, we see at the regional level, there will be peer reviews led more by the regional economic commissions, and certainly many different regional intergovernmental bodies such as Africa Union and CARICOM and others have started to include regional-based processes as well, which are linked to regional commitments, such as the Africa 2063 efforts. So how can adolescents youth have a strong voice within those processes as well, which often are with ministers, but also with heads of state at that regional level? And we have seen a strong focus, such as through the African Union, a focus on the demographic dividend. So we see that as a strong opportunity for youth engagement and youth leadership in some of those processes. But also, I think some of the other important instruments are the human rights mechanisms and bodies, where countries also have their UPR reviews, and really recognizing that health is a right, and access to those services, and particularly for adolescents, is important as well. So how can we ensure that those issues are well integrated into the human rights bodies? So we have the human rights councils twice a year, and the discussions there. I think we need to ensure that there is a focus on adolescents' rights as well. And then lastly, I want to just quickly touch on the Global Strategy Indicator and Monitoring Framework, which was launched in 2016 alongside the World Health Assembly resolution on operationalizing the global strategy. And that indicator monitoring framework includes 60 indicators, and recognizing that many of those are aligned with SDG indicators, but also recognizing that SDG indicators did have a shortfall when it came to adolescent-focused, specific focus indicators. So this indicator monitoring framework includes 60, and a number of those are adolescent focused, such as monitoring and tracking adolescent mortality rate, adolescent birth rate, proportion of children and young people in school with proficiency in reading and mathematics, and proportion of women and children and adolescents subject to violence, etc. So recognizing that to be able to achieve better health and well-being outcomes, we need to also address some of the social determinants of health. So ensuring that education, access to education, nutrition, water and sanitation, all of these are also critical enabling factors for better health outcomes for adolescents as well. So this year, PMNCH is leading the development of the first Global Strategy Progress Report against these indicators, but also recognizing that there are many gaps at country level in terms of the availability of that data. So needing to have data better aggregated by age to better reflect adolescent and youth progress, and also, of course, disaggregated by sex. But also needing to strengthen a lot of the data systems to ensure that we can better track progress. And as many leaders say, what you track gets done. So I think that's one of the critical factors that we need to focus on overall. So I'll stop there, and I'm sure many of our presenters later on will delve into some of these opportunities in more depth.
Thank you very much, Nana, for those remarks. That was indeed very comprehensive, and I think it was a brilliant presentation, giving context on the Every Woman, Every Child movement, and providing also a bit of background on the Survive, Thrive, as well as a transform goal of the revised global strategy, and giving also a bit of context on the need for young people to be involved in youth-led accountability mechanisms as a way of improving on delivery for the health and rights and well-being of adolescents and young people. So thank you very much for that. Now I'd like to move to Patrick Moesije from Uganda. Now Patrick is also a member of the PMNCA's Adolescent and Youth Constituency. He, together with other young people in Uganda, have a coalition of young people who work in the areas of sexual reproductive health health and rights, and he has been extensively involved in the process of accountability for the ISA Ministerial Commitment on Sexual Reproductive Health and Rights, as well as comprehensive sexuality education for East and Southern Africa. So I'd like you to just share with us a bit on your experience being part of the accountability processes and structures of the ISA commitment, and possibly the best practices from that experience from your view. So Patrick, you have the floor.
I hope you can hear me, right?
Yes, we can hear you very well.
Perfect. So thank you very much, Gigi, and all the young people on the panel today from the different parts of the world. It's my pleasure to join the webinar, and to all those who are tuning in, listening in, and thank you for being part of this panel, rather this webinar. And thanks to PMNCH for always providing young people an opportunity to showcase what they do, and also to voice out their needs, their issues, but also importantly to show the potential and the commitment that we have towards making the world a better place for us all. My name is Patrick Messige, and I work with the Uganda Youth and Adolescent Health Forum as the team leader. And I'm also a member of the PMNCH Adolescent and Youth Constituency. So I was tasked today to, speak about youth-led accountability under the ESA commitments. And I'll possibly start by briefly talking about what the ESA commitments are. And the ESA commitments are the ministerial commitment on comprehensive sexual education and sexual and reproductive health services for adolescents and young people in East and Southern Africa. Like some of you are possibly aware, in late 2013, under the leadership of UNAIDS and with the support from regional economic communities like the East African Community and SADC, which is the South African Development Corporation, the United Nations initiated a process that aimed to develop and implement a commitment around the needs and rights of young people. And to be exact, on the 7th of December 2013, ministers of health and ministers of education from 20 countries within East and Southern Africa gathered in Cape Town, South Africa, and committed towards a vision of young Africans who are global citizens of the future, who are educated, who are healthy, who are resilient, who are socially responsible, who are informed decision makers, and with the capacity to contribute to their community, country, and the region. It is this commitment that was later to be known as the ESA commitment. The initiative has now expanded to include core UN partners and civil society organizations. The commitment has also brought together both education and health sector policymakers and young people to collaborate and strengthen sexual and reproductive health rights. The endorsed commitment has an accountability clause that binds countries to deliver on certain targets and it has a given time period. You will also note that the commitment has specific targets that countries must deliver on. And we had targets for 2015 where countries really made a lot of progress, and these include, among others, a good quality comprehensive sexuality education curriculum framework to be in place and being implemented in the 20 countries, pre and in-service section reproductive health and comprehensive sexual education training for teachers and health and other social workers are in place and being implemented, and decreased numbers of adolescents and young people who do not have access to youth-friendly services by 50%. This includes equitable, accessible, acceptable, appropriate, and effective services related to HIV. So those were the commitments for 2015. And specifically for 2020, the commitments that countries are still working on to consolidate recent and hard-won gains in the reduction of HIV prevalence in East and Southern Africa and push towards elimination of new HIV infections among adolescents and young people of ages 10 to 24 years, pre and in-service sexual reproductive health and sexuality education training for teachers, health, and social workers to be in place and are being implemented. increased by 90%, 95% the number of adolescents and young people aged 10 to 24 who demonstrate comprehensive knowledge on prevention of HIV, reduce early and unintended pregnancy among young people by 75%, eliminate gender-based violence in child marriages, and lastly, increase the number of all schools and teacher training institutions that provide sexuality education by 75%. So you note that the commitments are really ambitious, even within a short time, but there's been some level of progress. So I just want to now share briefly in terms of how, as a young person, I have actively participated and engaged in accountability processes for the ESSA commitments. I'll start with my country, back here in Uganda. Back here in Uganda, in our context, young people have been very active in working together. Can you hear me? Hello?
Yes, Patrick, continue, we can hear you.
Okay, yeah, I got some feedback. Yeah, so young people have been very active in working together with and supporting and holding government of Uganda accountable through the Ministry of Education, the Ministry of Health, on the ESSA commitments. We have actually successfully lobbied to be part of the interministerial committee for the ESSA commitments, which is chaired by the Ministry of Education. This is a high-level multi-stakeholder membership committee with representation from line ministries like Ministry of Health, Ministry of Gender, which is also responsible for young people, the local government, the Uganda AIDS Commission, and also membership from national and civil society organizations. So as young people, we've been part of this process, and we have tried as much as possible to influence the work plans, the national work plans, in line with achieving this commitment, and have strongly pushed for, government to deliver on some of these commitments. For example, we have been, squeezing to the wall the Ministry of Education to finalize the process of the national framework for sexuality education. At the moment, the country does not have a framework for sexuality education, so which makes it very, very difficult to regulate how sexuality education is passed on, and when, where, how, which age group, what falls under what age group. So we've been pushing government, to make sure that there's a national framework where all different partners can fit in to be able to deliver sexuality education, and also to agree to right-based kind of sexuality education, that is age appropriate. And we have also, worked with and held accountable Ministry of Gender to put in place a national strategy for ending teenage pregnancies and child marriages. And as I speak, in 2015, we were able, the government of Uganda was able to put in place a strategy. And as young people, we've actually been working with them to disseminate, but also support implementation of national strategy to end teenage pregnancy and child marriages at local government level through establishment of, through establishment of technical working groups at the district level to be able, to support the action plan for the strategy. And importantly also is that at the moment, the country does not have a policy on sexuality education. And there's a draft policy in place which has been on the shelves for over 10 years, but we have been, holding government accountable. We have mobilized young people. We've marched over the streets before. We have lobbied and held Ministry of Education to make sure that this policy is in place. We are still in discussions. Uganda is I wouldn't want to call us a conservative country, but religion and culture are elements that really still define our society and who we are. So we need to tread slow, but and at times the institution of the culture and religious institutions largely inform the way government runs business. So we are slowly by slowly, as young people, holding on and working with government to make sure that the school health policy is passed. And lastly, last year, yes, just like in less than a minute, last year, I'm glad we have White Ribbon Alliance represented on this webinar. We worked with White Ribbon Alliance as young people in Uganda to petition government of Uganda through the Office of the Prime Minister to put in place a multi-stakeholder strategy towards ending teenage pregnancies and child marriages. And we mobilized over 150,000 signatures from young people, from youth and adolescents. And we presented this to the Minister of Health. Yeah, so this is the kind of work that we've been doing. So we hope that as young people, we definitely cannot be left behind on matters that concern us as young people. We definitely have a reason to be engaged.
Yes, yeah, wonderful. As they say, nothing for us without us. I believe as young people in Uganda, you really epitomize that, and quite excited. I believe many of the people who are joining our webinar have a couple of questions that they would like to ask to yourself and Nana from what you've already shared with us. But now I'd like to just move on swiftly to Chandra from WHO, who's going to talk to us a little bit more in depth about youth accountability and why it's very important for young people and adolescents to not be left on the periphery of this process. So Chandra, just in a couple of minutes, would you please speak to this?
Thank you very much, and greetings from WHO. Could I have my first slide, please? Could I have my first slide, please? In my presentation, I'm going to talk about youth accountability with a focus on health services. I'm waiting for the first slide still. Okay. So I short presentation on with a particular focus on health services, which I put together with Kate Watson, who is a freelance legal and human rights expert. Could I have my next slide, please? 2 years ago, WHO published global standards for quality healthcare services for adolescents. This document has 8 standards. I put up 2 which are relevant to this discussion. In relation to standard 4, both healthcare providers and support staff are meant to respect, protect, and fulfill adolescents' rights to information, privacy, confidentiality, non-discrimination, non-judgmental attitudes, and respect. And standard 8 requires that health services involve adolescents in the planning, monitoring, and evaluation of health services and in decisions regarding their own care. Next slide, please. Now, studies from around the world point to the fact that these standards are not met. Many studies from many countries. Now, I'm just going to present findings from 2 studies, two reviews that we have published recently. Both relate to sexually transmitted infection. One relates to barriers to care, and the other is care seeking in adolescents. Both of these papers are available on request. Next slide, please. In the next slide, you will see some key messages about youth perspectives from this paper. Studies from many countries point to the fact that adolescents report that providers are rude or unfriendly. They blame them for what has happened, lecture them, scold them, not unlike what you see in the cartoon. So young people have a voice. They are able to talk about what's happening to them. They're able to complain about the fact that providers and facilities do not respond to their needs. We are just about to publish another review of mystery client studies. That means where adolescents have gone into health facilities, posed as patients themselves, and in several of the studies, adolescent girls report that health workers have made a pass at them, a sexual pass at them. So adolescents have a voice, and increasingly there are studies from around the world to obtain this voice, to get this voice. Next slide, please. So moving from voice to the next slide, which is about teeth. Voice is one thing, teeth is another. Now, WHO published a few years ago guidelines on ensuring human rights in the provision of contraceptive information and services. This document has 9 recommendations, 9 sets of recommendations. 9.1 is on accountability. 9 is on accountability. This contains 2 recommendations, And 9.1 says, recommend that effective accountability mechanisms are in place, including monitoring and evaluation, and remedies and redress at the individual and systems level. That's very important. Remedies and redress. Next slide, please. In this slide, you will see that we assessed national contraceptive policies, strategies, and guidelines from 10 countries listed on the slide. We're completing a similar exercise in Southeast Asia. We looked specifically in relation to this slide on our accountability mechanisms mentioned explicitly. This did not assess whether these accountability mechanisms are working. This merely looked at whether accountability mechanisms were called for in policy, strategies, and guidelines. Now, Kenya was the only one which talked about human rights bodies assessing, acting on complaints from adolescents. Nigeria and Zambia mentioned monitoring as well as mechanisms for addressing complaints. So only in 3 of 10 are any mechanisms for the voice to have teeth. That means adolescents can complain in many countries, but their complaints don't reach anybody with any influence, and so their voice is left without any action. Next slide, please. And this is my last slide. It's an interesting paper that Kat Watson pointed me to. Social accountability, what does the evidence really say? And this interesting paper points to the thesis that social accountability initiatives are overwhelmingly based on the assumption that information is power. We need to generate information, and that information will itself lead to corrective action, remedial action. But in fact, from their review, unless voice is combined with teeth, that means the voice of citizens is combined with mechanisms for this to them, very little happens. So to conclude, there are many issues in health service provision in which adolescents' needs are not met, in which their rights are not fulfilled. There's growing recognition that we need to hear adolescents' views, different groups of adolescents, male and female, older and young, married, unmarried, rural, urban, educated, uneducated. Many studies are publishing their views. Very few initiatives still are taking this voice and saying, so what do we do about this? Who's going to act about this? Who is accountable for these actions? And that is the frontier that we need to move in. I dare say that is true in other areas, but my presentation was specifically on health service provision. Thank you very much.
Thank you, Chandra. That was such a very interesting presentation as well. And it was so great to just see and hear a lot more of the evidence part of it when it comes to accountability. And there are a lot of young people out there that can actually relate to what he's saying in terms of, visiting different health centers and being treated in a certain way, the stigma that's there and the attitude about the healthcare workers. And one of the key things when we're talking about accountability is how do we hold health workers like that accountable for ensuring to providing youth-friendly services so that young people can feel comfortable visiting these centers. So very valid points that came out from Chandra's presentation. And I'm sure you have questions. So get questions going on. You can send questions, and at the end of, after we hear all the panelists, we'll be picking up questions and we'll be addressing them to the different panelists so we can get to hear more and understand more about their expertise and what they've seen and heard on the ground. Moving on, now we've been hearing more on, we had Patrick earlier on. Thank you to my co-host, Gigi, who is the chairperson of the Adolescent and Youth Constituency, for picking up and driving on. This is what we mean by young people taking the drive, and we are leading this webinar. So thank you very much, Gigi. So now moving on. So we talked about and heard about Patrick's side of it, as young people leading on different initiatives. Let's hear more from UNICEF. We have Tamara from UNICEF, who's going to be talking about the Adolescent Tracker. Now, let's get to hear more about how this tracker can be a useful tool for people like us and adolescents on the ground to take lead in accountability.
Well, thank you so much for that introduction. It's lovely to see so many people and to be hearing about all the different things that are going on around the world. I was interested in two things. Nana said earlier, what you track gets done. And Chanda was talking about how information is power, but we also need teeth. So those are two things that we've been thinking about a lot. And our journey on the Adolescent Country Tracker started back in 2015. Can we go ahead and have the next slide, please? And that's when a group of organizations came together to really look at how we could go about advocating for more action on adolescents and young people. But one of the things we realized very early on is that there's no actual global framework that looks at adolescents from the age of 10 to 19. There was no way of getting information and indicators on what's happening there. So on the one hand, we felt it was really important to be telling the story about why we should invest in adolescents. We kept saying that we felt the MDGs had been blind to young people, but we didn't have the information there to hand to be able to tell the story of this is why we should be investing in young people and adolescents. So a group of organizations from the UN, from the donor community, and from international NGOs decided to try and come up with a global framework that would help address that would give us information at a country level, a set of indicators against which we could measure progress for adolescents. Now, on that, we also wanted to explore the fact that young people's lives are multidimensional. Yes, health is very important, and we've been talking a lot about health today, but there's also other aspects of their life. So we wanted to capture it across the many multi-dimensions of a young person's life. Can we have the next slide, please? So what we've come up with is this country tracker, which is basically a 5x5. And we look at those domains, as I said. One is obviously health and well-being, critically important. Then you have education and learning. We're also looking at transition to work. So we know that as adolescents grow up, they want to be able to make that transition to work. Are they well positioned to do that? The other critical area is protection. Are their rights being protected? As you said before, do they have teeth? Are they able to express themselves? But are their actual rights being protected? And then you have an area that we call participation and engagement. And we wanted it to be simple. We didn't want this to be very complicated. We felt it was really important to be able to disaggregate this information by age, by sex, and other relevant characteristics. But it also needed to be universally relevant. Like the SDGs, we wanted this to be just as relevant for children in Sweden as it is for children in Lesotho. And that was an important criteria. We wanted it to be linked to other efforts that were already ongoing to collect information, particularly the SDGs. We didn't want to duplicate anything. We wanted to be getting globally available data and being able to put it in there. But the most important thing is that we wanted this to be able to stimulate action at a country level. Now, before I move on, just a quick note, you'll see that the green column is empty at the moment. And that's a big one. It's called participation and engagement. And that comes back to what Chanda was talking about, teeth, too. Are young people able to engage with governments, get governments to listen to them? Do they have voice, and are they being heard? What we found, however, is that there was just no indicators out there that we could use that already exist. So we've started a process to actually try and develop indicators around that. And again, it's critical that we wanted to be able to measure them at the level of the young person or the adolescent, at an outcome level. We didn't want to be talking about process, or is there a strategy in place, or how many children are invited to children's parliaments. We wanted it to be at the outcome level. What does it mean for a young person, for an adolescent, if they're participating? How do we know that they have voice? How do we know that they are being listened to? What does agency mean? So that's what we're working on at the moment, to try and define that better with young people as to what that really means for them. Next slide, please. So the first thing is that we wanted this to be a tracker versus an index. We didn't want to try and weight different things or say this is more important than others. We wanted to be able to give numbers. And the importance here is that this is really much a tool for advocacy fairly much at the national level. This is not something where you're going to be able to track progress on a specific project or a program. This is to actually stimulate action at the national level, getting government to listen to us, to talk to compare what's going on here. So when we piloted this in a number of countries, it was a really interesting experience. And I have to say, it wasn't completely youth-led, the piloting, and this is something we'll want to work on going forward, but we certainly involved youth. And going forward, we want to look at how we might have this completely youth-led on some occasions, and others times a variety of stakeholders coming together. But the tool raises questions rather than providing answers or solutions. And again, this is important. So for instance, in some countries, when they started looking at the data, they, suicide rates are really higher amongst boys in our country versus girls. In other countries, they're higher amongst girls. What does that mean? Some countries actually say, we don't believe this data. And so then that helps too to say to governments, well, then we need to collect better data at the country level. Are we really getting this information? Another example was on child marriage. We know this is something that young people are very passionate about. When we did our consultations around the general comment on the Convention on the Rights of the Child recently, universally across the world, young people wrote in saying, we really want the age of marriage to be 18 with no exceptions. And so one of the countries that was piloting this actually had their child marriage figure, and it was incorrect. They were actually using a figure that did not represent what was going on in the country. So by getting this, by looking at it, by digging down into the data, it really stimulated discussion about what does child marriage mean in our country and to us. So that is the idea of this tool. As I said, it's not solution-based. It's to help raise questions, to stimulate discussion, and to get governments to begin to really dig down, and other stakeholders too. So we would hope that in many countries, this sort of national level adolescent country tracker would then be used to produce more detailed ones for sub-regions or for specific groups. So adolescents with disability or specific subgroups where people would like to raise issues and get action to be taken. And lastly, the countries that did pilot it liked the fact that we were linking it very strongly to the SDGs, because governments don't want to be collecting data twice, and the SDGs have provided us with this new framework. So let's use it. Let's make sure we have that information and data, and that we can use that to stimulate action. So that is what we have been aiming that this tool should be used for, and we're really excited going forward. We've piloted it right now. We hope that it will be able to go live this summer with data that we will be providing for countries around the world so that they can compare themselves and actually take that into their country for advocacy and action. Thank you.
Thank you so much, Tamara. That was very insightful. And, thinking about it, I'm thinking to myself, this is what we need. Asking questions and stimulating discussions, because you find that a lot of young people like ourselves who are leading different youth-led organizations, we're in a place where, we're having consultations. Yes, we're giving inputs, but perhaps we're not really asking those questions that will generate the right evidence and the data to drive issues of adolescent health. And as well as having that discussion with government and the different stakeholders, that we need to work together in partnership to drive discussions. I'm sure we'd love to hear more on how can ourselves as youth-led organizations, youth networks, young people actually come on board and work with you as implementing partners, using the tracker and driving the tracker ourselves. We'd love to hear more, and we'll come back to you. But moving on, we have our last panelist with us. And this is we're hearing from Winfred, which is, she'll be talking about citizen hearing. So over to you, Winfred.
Thank you, Tikala. Hello, everyone. I'm Winfred Dongom from White Ribbon Alliance Uganda, a citizens reporter advocate, and I'm speaking on behalf of the Citizens-Led Accountability Coalition on RIMNCH. Can I please have my first slide? The citizens' hearings, as you can see, this picture shows young people handing over 120,000 signatures to the Ministry of Health, Minister to act out teenage pregnancy. Can I have my second slide, please? Citizens' hearings are a social accountability tool for RIMNCH. It's used in villages, districts, and cities, and it's used on the basis that the people who are facing the problem are best placed to give us solutions to what's happening. So during the citizens' hearings, we had young people, health workers, district leaders, policymakers, CSOs, and media who help build momentum and bring out the issues that are being discussed during the citizens' hearings. And as I said, I'm speaking on behalf of the Citizens Hearing Coalition, which involves IPPA, Fight Tribunal Alliance, Save the Children, and World Vision. Can I have my second slide, please? From the citizens' hearings, we had the global citizens' hearing, which happened in 2015 and 2016, where issues were shared with the global family in Geneva. Citizens' hearings informed the global health strategy on women's, children, and maternal health. And these citizens' hearings were there to amplify voices of the people in the communities, districts, countries, and the world at large. And it informed, as I said earlier, it informed the global strategy for women's, children's, and adolescent health. Slide, please. These citizens' hearings are not only used to inform or share challenges young people face, but they're also used in other advocacy campaigns. Like currently, it's used in the Act Now to End Teenage Pregnancy campaign, where some signatures were collected online. Even though we didn't reach very many young people physically, we managed to meet them online and collect signatures from them that were used to petition the Prime Minister. And again, with this same campaign, when we were supposed to meet the Prime Minister acknowledged that he saw the momentum of the campaign on social media. So this brings me to the point that we young people, as we are into the tech world, the digital world, we should be able to use social media to constantly engage our leaders. I've seen very many leaders taking on social media to share ideas. It's also happening in Africa and in Uganda. So having the Prime Minister acknowledge and appreciate that he saw the campaign online there for us and hold him accountable and track him for progress and other activities. Then to the citizens' hearings, after that, citizen journalists were trained. Citizen journalists like me are young people who are equipped with skills on basic journalism and human rights, who later on helped on tracking progress and reporting. So we didn't just leave it at that, because it's important to have a feedback mechanism in the community and the leaders. So we had the citizens journalists helping to create the reporting and tracking system. Then during the citizens hearings, young people gave testimonies. You know, we had a member of parliament get dumbfounded and shocked that there were young people in her community, children who are below 15, visibly pregnant. So I think it brings the picture. They see what's really happening and they get to know they need to act faster. When they read these statistics, it may not really affect them, but in the citizens hearings, they saw it and it affected them greatly, that they acted immediately. We saw youth corners in some health facilities being placed, and for other maternal health services being catered for, like theaters and others. Then my experience as a young person, personally, I've been using social media to reach young people and also leaders. And this has also exposed me to leaders I wouldn't access. You say you want to meet, maybe say a commission of in Ministry of Health. You can't meet them physically. You create appointments forever, but you send a tweet or maybe share a video of what's happening in some community. When they see these videos and pictures, they are bothered and they feel they need to act immediately. So I've used social media greatly to reach the leaders. And then as a young person, I've also been able to share and inform young people using my social media accounts. And this has also helped Fight Tribunal Alliance Uganda, where we have Twitter chats quarterly. And this keeps building the momentum and they make you forgotten. I stress so much on social media because maybe the adults and some other people have that stereotype where young people, we're watching funny stuff online. But I feel since we have this internet and other stuff, we can still use it to influence decision makers and also understand other issues that affect us and share them among each other. Then White Tribune Alliance, together with the UN Women, trained citizen journalists, not only in Uganda, but you have citizen journalists in Malawi, Nigeria, India, and Western Bengal. So I feel that having citizen journalists who have basic journalism skills, because at times you want to engage media, but the media person may be into profits and maybe they're looking at making news. So if it's not making serious news to them, they may ignore it. So it's important to equip young people with these skills so they're able to be strategic, position themselves directly, and share what's happening in their communities with their leaders. And when the leaders see that these people, the young people, so that political leaders are watching what's happening down, they know people are watching them, young people are being proactive. They're not just going to go to the streets and make news, but they are doing things with evidence to go to the communities and share what's happening. If you go to a health facility and you see blood on the floor or see a mother sleeping on the floor or you're being denied services, why don't you share it? Why keep quiet? So this affects not only us, me as Winfred, but affects all of us as young people, our sisters, our brothers, and the future generation. So I find it important for us to keep engaging the young people, because young people don't want to just be beneficiaries or benefactors of programs. They want to be fully engaged in designing, implementing, monitoring, and holding them accountable. So most times you always feel like, oh, the young people, we call them for meetings on accountability, and they are not active. It's very hard for you to engage them if you bring them at the last point. So engage them from the start, designing, implementing, monitoring. That's when they feel well appreciated and they are great agents of change. So let's not take young people for granted. Thank you.
Thank you so much, Winfred. I think it's always so incredible to hear a fellow young person really share, the experience on the ground. And it's so true that, most of the time we focus so much on the numbers and the data. But when you hear, the real life experiences and the testimonies from the young people, it really opens up our eyes in terms of the challenges that young people are facing on the ground, on community level. And we really have seen, also from experience, we actually have seen that leaders from different government spaces who necessarily are not on the ground, when they hear those experiences, they're actually so moved to take immediate action as well. So thank you so much for so we're having a bit of connection. That won't stop us from going on with discussions and just, from questions that I've been hearing from other people that have tuned in. Some of the things that they would like to know from the panelists themselves is, what has been your biggest lesson, with the different initiatives you've had, the experience you've had as well. And another thing is, going forward, what support do young people need? Patrick, we will start off with you. Being a young person and, with the experience you've shared and the initiative you were involved in, what was the biggest lesson? And as a young person leading this network and working with other youth organizations, what support do young people need?
I'm assuming everybody can hear me.
Yes, I can hear you crystal clear.
Perfect. Yeah, so, I think like Winfred shared, as a young person, one of the experiences I've gone through as a very active, enthusiastic, dynamic, energetic young person out there who wants to make a difference, who can categorically identify certain issues and try to bring them to the attention of those who matter, is that very many policymakers out there, and not only policymakers, but also people of responsibility, really have not yet really mastered the art of valuing the contribution of young people. Many of them want to assume that we are still young, because in our culture where we're raised, when you're young, you are expected only to listen to what the adults say, and you don't have that space culturally to put put out there your issues, So one of the challenges that we've really faced, and we really still face today as young people, is that, you're considered to be very young, and at times your contribution is not given all that attention. It also comes, like, for example, in the funding stream, like when we design very incredible programs, accountability programs, and you're competing for funding from donor expert because you're a youth organization, maybe you're still struggling to put systems in place and together, even the donor X is not sure whether they want to support you. But what kind of support we really need? I think it's important that we need evidence. There's definitely need for evidence in terms of what works, such that as young people, we need to be supported to be able to interpret this evidence and be able to integrate it into our advocacy, advocacy and accountability interventions and measures as we reach out to policymakers. Because to me, it's this evidence that can make the policymakers move. And then importantly, also, we need technical and also financial support in terms of like pulling the stories of the young people that we directly interface with down there on the grassroots level, and being able to give these stories a voice as far as accountability is concerned. Like we work with these young mothers, young people living with HIV, victims of violence, and many others who we reach out to as young people. But at times you find the space, the opportunities, the resources to amplify and make their voices heard is still a challenge. But ideally, I think it's important that we are supported in terms of amplifying the voices of these young people, and we're also supported in terms of interpreting evidence and being able to integrate evidence into demand, like creating, rather demanding for equality in terms of services and all that. Yeah, thank you.
Thank you, Patrick. What you have shared is definitely what a lot of youth-led organizations and youth-led networks go through, the opportunities and resources. You said two key things: resources and opportunities. Opportunities to access those resources, and opportunities to be in a space to collaborate and to work in partnership with those with the resources, and as well as also to empower youth organizations to take lead on some of these processes, on these issues as well. So thank you so much for that input, and I'm sure those who are listening have really got it in, and donors and partners that we want to work with, the government as well, are really taking this in so that they can do things differently. Now, moving on, I would like to hear from Chandra from World Health Organization, being the man behind the evidence and the expertise when it comes to accountability at country level. Please do tell us, what has been the biggest lesson from the findings that you have found?
Thank you very much. I think non-government organizations have led the way in providing health services to adolescents, particularly sexual and reproductive health services. And many useful lessons have emerged from the work of organizations such as IPPF, the International Planned Parenthood Federation, and Mary Stopes International. Another example is Save the Children. So what they've done is they've put in place mechanisms to gather information from young people. In my presentation, I had a little cartoon of young people placing them in a little box. It could be that, or it could be a periodic meeting with facility managers, service providers, where young people could give feedback, honest feedback, on both positives and negatives, and then work with providers to try to solve the problems. Engender Health, another international NGO, has developed a process called a COPE process, where people sit around, different stakeholders sit around, including young people, and articulate their problems, their concerns, their needs, and work with providers to find solutions. So this doesn't then become a battle of I did this and you didn't do this, and I said this and you didn't say this, but it provides adolescents an opportunity to give critical feedback. So those mechanisms are there in the NGO community, not in all NGOs, but in some NGOs. Our challenge is to take them and operationalize them in the government. Those are the lessons. I think the lessons are there, but they are still there in small, piecemeal, localized initiatives. We really need to take that and translate that and apply it at scale. But this is not just with accountability. I think in terms of youth participation and leadership as well. In many places, it is token. It happens more at the global and possibly at the national level. It needs to happen much more at the local level, the everyday issues. And so to conclude, there are lessons from some NGOs. We need to take them and translate them into government systems and then put them in place and monitor how this is working. Thank you.
Thank you, Chandra. When you said token, as youth leaders in the spaces, that was one of our key advocacy points, because, you find that a lot of young people, when it comes to participation, you go to this meeting, you give a presentation, you share experiences, you go back and, there isn't a follow-up, there isn't a space where they said, you shared this experience, or you shared this, initiative, this strategy, how can we work together? And I think that's something we can start doing differently. After young people have been involved in certain meetings, let's go back and engage with that young person and say, let's sit and actually work together in developing that program you suggested. Let's implement it together. Let's review it together, so that you were really bringing out that a lot of our countries need to take back home with. Thank you so much, Chandra, on that. Moving on, we would like to hear more about the Adolescent Country Tracker. Tamara, a question that is coming about is to, being a young person representing the adolescent and youth constituency, where we have a lot of youth-led organizations as members here. We want to know, what value added can we place with the Adolescent Country Tracker and actually rolling it out or implementing it in different countries? So in other words, how can the adolescent youth constituency you to Adolescent Country Tracker?
Thank you. I think that's a great question. And we actually want to hear from young people too, in terms of how they think they could use this and what it might mean for them. So this is, again, this is a two-way process. I don't think we have the answers. This is a tool that can be used in many different ways. As I said, from the experiences we had so far, young people came together within constituents and began to have discussions with ministries. And that was one of the first times, even across ministries, Ministry of Health and Education and Labor, sat together in the same room and looked at data. And it was eye-opening for people to say, well, I only ever think about mortality. I hadn't really thought about whether our young people are going to school. So, and why that might be important for us. So I think it was a big breakthrough, just getting people together in a room who don't normally sit together in a room. But it's going to be country specific. I think in some countries, young people are pushing on an open door. The government is actually just desperate and keen to find ways of working together and to think about what is it that adolescent issues, what do we need to address? In part because they have to answer to the SDGs, but also because they recognize that these are big issues. In other countries, that door is more firmly closed, and we might need to do other things there. I think an important criteria, as I mentioned, is most marginalized. What are we doing for groups of adolescents and young people who have really been forgotten? So the SDGs talk about not leaving anybody behind. What does that mean? So working with networks of that advocate for people with disability, for instance, can we begin to spell out some of this information for that particular group? We know that adolescents with disability are almost never reached with messages around sexual and reproductive health, because people assume that they're not sexually active, which is not true. So how can we work with those organizations? The other important thing, I think, is that we've been advocating very much is you can't just start when people are 18, 19, 20, we need to be giving younger people a voice. What do we need to do with the 10 to 14-year-old to help build voice for them so that they can begin articulating? Can they have a role in student councils? Can they have a role in church groups? Where can their voice be amplified so that people hear them and listen to them right through? The same is true that 10 to 14-year-old group has been universally forgotten by healthcare centers. Again, they often turned away because they shouldn't be seeking health related to sexual and reproductive health, or they're all in school, so they should be learning, and we know that they're not. So that's another thing that we feel that 10 to 14-year-old group really needs to be highlighted by this tool and by youth. We have youth really can play a role in advocating for these younger children who will grow up to be the youth of the future. So we want to hear from you and how you feel that this tool would be useful and how we can convene discussions around using it. Thanks.
Thank you so much, Tamara. So she said it, as young people who are listening to this webinar right now, the biggest question is, how do we reach the marginalized? How do we ensure that young people as young as 10 up to 14 are actually involved in this process and their voices are being amplified? And we have a young person in our panel as well. We had Patrick, we heard from Patrick, but Winfred, let's hear from you. Tamara asked very valid questions. You know, how do we actually work with the marginalized organizations and communities? And how do we ensure that voices of those young people who are aged 13, 10 and 14, their voices are amplified?
Thank you, Tikala. To reach the marginalized, we as White Ribbon Alliance have been working very closely with AFRIAN, which is a network of very many youth-led organizations in the country. And those youth-led organizations, some work close with the marginalized young people. And as I said earlier, it's important, whether they are 10 years old, 12 years old, it's important for us to work with them directly so we better understand what they are facing, and they help us come up with solutions. Most often, the dignitaries and others sit down in rooms and agree and decide for these young people. But I believe a 12-year-old will be in position and say, I face this problem, and we as young people think this will help us. And so for them to decide whether it's the best solution, but then they'll also work closely with the different organizations and policymakers to see what is most suitable for them, irrespective of age or social status. So as we are doing all this, and then I think most importantly, as we're talking about data and indicators, I think we need to come up with indicators that are related to the targets or objectives. I think that's another challenge. Most times when policies are brought up or programs are brought up, they're objectives, but then when you look up and look to the indicators, there's no relationship. So in the end, it's very hard to even track progress and monitor whether the objective is being achieved. So in the end, most times the young people are left out. And as I said, to help amplify voices, not only at national and global, but at local level, meaning everyone is fully represented. So I think most importantly is to bring everyone on the table. If it's about health workers, let it be the young people, health workers, the district leader, every leader, so that they get to interact. The health worker will say, maybe we don't give them these services because we don't have anything. We have stockouts. Then the district leader will be responsible to answer why there are stockouts. So it sort of helps you get a solution from the bottom to the top. Thank you.
Winfred, before I let you go, and I have another comment to another panelist, there's just one follow-up that we would like to take to you. You know, as a young person and being a youth activist, working on the ground, working with the marginalized community and working with, you know, the adolescents at between the ages we've mentioned, what are the challenges, you know, that you face as a youth activist working on these issues, and how do you actually overcome these challenges?
I think she's muted, Perhaps you can just remind her to unmute.
Winfred, your mic is muted. Please unmute it so we can hear you share your views on that.
Oh, thank you. Like I said, the most important is space. I know space for young people to come and perform or do dances, but for young people to talk, and not for only one young person to be on the panel, but to have a big number of young people share their views, because it's not just one young person. So most times for these engagements, they'll invite only one young person. I'll share the views of the others, but it's not well represented. We need to have like very many voices of young people come together and amplify them and bring the points back home and get solutions. Then second, I think the most important challenge is capacity building, not only through giving space, but financially, more investments should be given or allowed to youth-led programs or youth-led activities, because very many young people out there are very passionate to bring up change in their communities, but they are blocked because there is no way for them to reach or help or work around those. So in the end, they end up losing interest. They feel like maybe this is only the adults, maybe it's not just for us. So I think as we try to engage them and said, let's invest in them, because when you invest in a young person, you are going to see change. It starts with them. Don't wait for them to get to 26, 30 and think, okay, right now let's engage the young person. It starts when they are young, mold them and bring them back to.
Winfred, I loved that. Invest in young people now, not later on, not when they're 26, but now, as young as 10 years old, because they do make up the human capital of fostering our own countries and economic progress. So the importance of investing in them is now. So I really love the fact that you brought that out. And talking about investment, and looking into accountability, Chandra, I would like to come back to you and hear more, on the evidence you've had and your views on this as well, because another challenge that we hear about is on issues of accountability at national level, institutionalizing accountability in government structures. When it comes to youth leadership and participation, you see lack of that, especially in government structures. How can we actually change that? Because there's a lot of social exclusion that happens when looking at leadership, youth leadership, being involved in the government structures. And those are the key platforms of ensuring accountability is being accelerated. So how do we ensure, that is actually corrected?
Thank you, Tikala. Tamara made a comment earlier about the importance of trying to use mechanisms like school committees. I'd like to say, first of all, a small example. Some years ago, the Indian government started requiring local government, that's the lowest level of government, to have a reservation for women. That means they needed to have a few seats for women politicians at the village level. Now, everyone said this is going to be token, nothing's going to be achieved. This is going to be wives and sisters-in-law of male politicians. And that's exactly what happened in the beginning. But after 5 years, what happened is more and more women, including the wives and sisters-in-law and sisters of male politicians, started taking interest, started engaging. Harvard University did a study of local government units in India with women who met a particular quota compared to and the decisions that they made compared to local government bodies without women's reservation. And they found dramatically different decisions made and the way in which these decisions were made. Now, evidence like this means that nobody can question the value of women's participation in local government. We need to use opportunities to create openings for young people. For example, in district health management teams, in district AIDS committees, in school sexuality education programs, in adolescent-friendly health service initiatives. And we would be very glad to work with PMNCH and its youth network to identify tangible things that young people have achieved through making these, through participating in these committees. Over a 6-month period, what decisions did they table? What proposals did they table? What decisions did they influence? Because I think the best way of influencing what is done by governments is by evidence that this is doable and this can produce results. As I said to you earlier, we have that from NGOs, but I think working together, we can strengthen that evidence base from at least half a dozen countries in the next 2 years. Look forward very much to working with you on this. You believe in youth participation. I do too, but we need hard evidence to convince decision makers that the young people sitting in the room are not just a decoration or to please some donors somewhere, but actually that they can improve the quality of decision making. Thank you.
Thank you, Chandra. Well, we heard that loud and clear, that working together and getting the evidence to ensure that as young people, our role in those spaces and the government structures is important, and ensuring that we also drive the political will of our leaders of getting young people and youth leaders involved in the processes that they're working on. You know, as we're wrapping up the discussion, you know, key things came out. Earlier on, we heard Winfred share, you know, that social media, young people, social media is an incredible tool in actually generating the evidence that we're also looking for and amplifying our voices. But then again, you have that countries that have blocked off social media, that has limited voices of young people to share their experiences, to share certain evidence and certain things, and that needs to change. So we push other countries and leaders from other countries that have blocked social media to actually inform them that this is limiting voices to come out and actually share and amplify voices that we're trying to drive of our young people and our generation. Another key thing is resource is key. The money talks with everything in every single process. So with accountability, there's a need to ensure that we have resources to drive all the different initiatives and support youth organizations to actually drive these initiatives and solutions that we have been suggesting in this webinar. So closing up, I would like to hear from each panelist. So you have your last minute. You just have to briefly share, going forward, what is your one key recommendation on this issue we have discussed? We'll start with you, Patrick.
Am I live? Can you hear me? Hello? Can you hear me?
We can hear you, Patrick. You can go ahead.
Okay. Yeah. So I think going forward, and my very, very last remark is that as young people, we definitely cannot stand to be looked on, or we can't let go. I mean, like, regardless and irrespective of whether we're given the platforms or not, we must do our best, because society has shown us that we can only sit and watch for opportunities to come our way, for our issues, for our needs to be addressed. Like, I think going forward, we just need to encourage and provide young people the spaces and the opportunity, encourage them as much as possible to stand out strongly, to stand out and, you know, like, demand for their space, you know, but also importantly, trying to be informed and to use available evidence and knowledge to be able to inform processes. Because what I've seen is that every time as young people we come out when we are very well informed in terms of existing processes, then the policymakers have no alternative, have no option but to listen to us. So I think going forward, it's important that partners like, you know, all the different partners out there should value the contribution of young people, provide young people the space moving forward. And I think there are very good examples that we can always borrow from. Like, for example, PMNCH, Adolescent and Youth Constituency is a quite interesting platform that we can learn from, and many other initiatives of young people, youth-led organizations in different countries where we come from, which are doing incredible, massive work. I think it's important that even as UN agencies, WHO, UNICEF, even as big entities like USAID and others, big funders, need to directly start working with young people, youth-led organizations, young people that have managed to organize themselves, get organized, set off. I think it's important that we start investing in them, work with them directly to make sure that we reach the marginalized voices down there that other processes could possibly not reach. Yeah, thank you very much.
Over to you, Chandra, your last remarks.
You know, having worked in WHO for Adolescent Health for 22 years, I couldn't, this is, for me, I've
lost Chandra there while he's getting his connection back on track. Perhaps we can hear from you, Tamara.
Yes, hi. Sorry, Chandra's back.
And institutions about donors and about the value of working. So, and can you hear me now?
Yes, we can hear you, Chandra. We didn't quite hear you, and I'm sure your last remarks are very important and watching this. So perhaps you can just briefly repeat what we take home your key recommendations.
Okay, my message is very simple. My message is that many people in positions of authority, including in positions of authority at home, do not believe that young people have a value added to decision making. In many cultures, including the culture that I grew up in India, young people, children and adolescents did not contribute to decision making. Parents and other adults did. And what we need to do as we move forward is to show the value of adolescents' contribution to decision making, to show that in action, and by doing that, to develop energy, interest, commitment to both do it and to invest in it. So that youth participation, youth leadership, youth accountability doesn't mean something that you do when the Swedish Ministry of Education or Development Cooperation is visiting the country, but something that you actually believe in and do with your own resources, your own time, your own energy. And the challenge is for all of us. We believe in youth participation, but there's a whole set of influential people who don't, the challenge to bring them on board is not theirs, it is ours, all of us. Thank you.
Thank you, Chandra. Thank you so much for that. And I think you should definitely join, youth-led activists, especially in push.
Well, this is Tamara Russino from UNICEF. I think we've just lost Tikala, but just maybe to make a couple of points, because I know that we are running over time. I would just say a couple of things. If you want to be heard, make sure you keep it simple. We've heard a couple of times from Chandra and others, use data and evidence whenever you can to make your point. Build your coalitions, but make sure you include the most marginalized. We have a role to play to ensure that we don't leave anyone behind. And then another call is build the skills of the younger generation as well as advocating with your elders. It needs to go both ways. Advocacy and participation is about rights and responsibilities. So let's make sure we do it in both directions. I think that would be my main points, but yes, resources are limited. Yes, it's difficult. But if you build coalitions and you stick to the information you have, I think we can have an impact. The other point that I thought was really interesting is the use of social spaces. That is something that is growing. You don't always need to have a physical space. Using social media is a new space for young people, as long as we don't forget that there is a digital divide and that we need to include the voices of those who don't always have access to those resources. But they're very powerful, and politicians and others are beginning to take much more notice of the kind of information that comes from that social media space. So use it to your advantage. Thank you.
Thank you very much, Tamara, for that wrap-up. Now also move to Winfred. Can you just, in 1 minute, just share your key message and take away from this panel? Just 1 minute.
For my key, thank you. My key message in response to you, Gigi, first is that young people have challenges in accessing advocacy links or having changes in advocacy. It's important for us to work in youth umbrellas like Afrian, because I feel it's important, instead of having one single voice of one young person, it's important for us to work together and have one big loud voice. So I think young people need to try and work together with other young people or other youth organizations, and then we need to make ourselves available for other organizations, that NGOs that have space for young people. But I think because in some cases, maybe we don't make ourselves available in a strategic and organized way, that end up missing out on these spaces. And then second, in cases where one has no access to social media, I think it's important to give young people at the grassroots level, in the communities down there who have access to internet and give them basic skills in reporting and tracking progress. Maybe have those books that they go to a health facility and keep checking every week and give feedback. I think the most important thing about working with young people, we need to have a feedback mechanism. If you don't give them feedback, they're going to lose interest. So it's important for us to work communities by giving them skills, basic skills like citizen journalists, spoke and just report on anything. And also they work closely with other traditional journalists, the media journalists, to share stories on what's happening. Thank you. She's muted.
Thank you very much for those remarks, Winfred. We heard you very well. Outreach, unity, young people working together and using our demographic way to make our demands heard. I think that was sweet and powerful. Now we'll move on to Nana. Nana, your main key messages that you'd like to leave the audience with from this panel in just about a minute.
Thanks, Gigi. I'll be less than a minute. As one of our panels say, keep it short. I would say be innovative in your engagements. Bring the energy and innovation of young people to those dialogues. Invigorate the discussion. Try to bring new solutions to the problems, because I think that's really the added value of bringing the youth engagement and voice, so that we can really advance together.
Thank you very much, Nana, for that. Very short and simple. Keep it innovative, keep it youthful, and keep it progressive. Now, to wrap up our very informative and engaging panel, I'm going to invite the Executive Director of PMNCH, Helga, who's going to give closing remarks. Helga, are you with us?
Yes, I'm with you. Absolutely. So thank you to all. So thank you to you, Tikala, and to you, Gigi, and all the panelists for your contribution. This has been really a rich dialogue, and we have noted, the importance of using data, the power of data and evidence, trying to hone in on marginal groups, on finding and or the groups that we need to engage with. Several of you have mentioned the importance of building skills, youth umbrella, and also networking, so that one is connected and feels the empowerment of being standing together. Young people at the grassroots level, I think it's important to try to find and connect in some way that not only becomes meaningful and powerful, but also capacity build with necessary feedback mechanisms and outreach. And then Nana's point about innovation and also in using the energy and maximizing that in innovative ways that use and look at not only problems but look at solutions. So I think that's being important. I think looking at some of the solutions and defining them moving forward, for us at PMNCH, this is why the youth and constituency is so important, and because we try to enhance and keep that portfolio so that it is relevant. It can be important for youth at many levels to engage and mean something. So I think that there needs to be some effort in defining that and moving forward. I would like to suggest to you that one could, as a means of capacity building, offers this type of webinar on a monthly or bi-monthly basis to see how to use it as an information networking in a way, and to see, and maybe a topic for the next webinar would be the advocacy toolkit, which PMNCH is working with Women Deliver, and to see how the aspect of youth using this toolkit to capacity build on their own advocacy on key issues pertaining to adolescents and youth is going to be important. Also, maybe what we need to do is look at a toolkit that we make available on our website for that we can then that have been developed by our various partners, which could be a resource center that can be used by all for various reasons. Mentioned the investment case that the Lancet series on adolescents have been now developed, and the Commission for the Commission on Adolescents, so that can be a topic also for next time. We would also like to see with you how to discuss what Nana alluded to, the high-level steering group, and how they want to move forward, and that one of the key priority areas that have been mentioned is actually adolescent. And one of the tools developed there is something that we call the advocacy roadmap. And this is a roadmap that identifies the key issues pertaining to the topic, priority area, and also the key ways of monitoring this. Also, it identifies a literal roadmap of all of the events related to youth and adolescents, so that we inform each other and we use these events from now until 12 months forward as stepping stones of amplifying messages or connecting, networking, and all of those issues. So that's another topic that could be covered. We are also in PMNCH putting together a small grant mechanism that is something that could also be discussed. The other thing is that, as you know, the Independent Accountability Panel report is focused on adolescents, so I would like to suggest that we get either the director or the of IAP to present that report and the key messages that are point to this within this webinar, and to see what the recommendations are from them. I think another thing is that PMSH is working on the youth and adolescent engagement plan of the constituency, and this could be also something that could then be discussed. This is going to be a face-to-face consultation in June, and this is an area that a platform and an opportunity to then discuss some of these things further. I think what we would like to see is not only our constituency, but our partnership can be an effective platform that can offer resource material, extra network resources, both in persons, in order to link better and plan better and engage better, and also be better represented, so that we can actually then is being preached, and also put this into an operation that is useful and is meaningful. And with that, I think I would like then from our side to say that this has been a rich conversation, and we hope that this then continues. Thank you.
Thank you very much, Helga, for those remarks, and everybody who has been part of the this webinar session. And if you're also going to be watching this from YouTube later on, I invite you to follow the work of the PMNCH Adolescent and Youth Constituency. And if you know of a youth-led organization, or you belong to a youth-led organization working with adolescents and young people between the ages of 10 to 30 in metrics of sustainable development, please go to the PMNCH website so that you can find out how you can be part of the Adolescent and Youth Constituency. I would like to thank all of our panelists, Patrick, Tamara, Chandra, Nana, as well as you, Winfred. I'd also like to thank Tikala, who has been the moderator for this session. I'd also like to thank Mimi, who has been providing support for this really successful webinar session. The key message is that we all have a role to play as young people, as stakeholders, partners, governments, and adolescents and young people. So it's very important for all of us to play that role if we are to deliver on the human rights and welfare and well-being of adolescents and young people everywhere. Thank you very much, and have yourself a pleasant day. Bye.